Okay, so we have, doctor writes an order for nitroglycerin in 5% dextrose injection. She wants nitroglycerin to be infused at a rate of 5 micrograms per minute. The pharmacy stocks 50 milligrams per 250 ml. How many ml per hour should the infusion run at? 5 micrograms per minute is the dose. 50 milligram per 250 is what we have. ML per hour, the answer should be ml per hour. Take a look at this bottle. Take a look at it very carefully. This is a real-life bottle that we use in the hospital. First, we're going to do dimensional analysis. Then I'll show you a ratio proportion. And at the end, I'll show you some tricks. So 5 micrograms per minute. We'll set up the dimensional analysis times. And we know that 1,000 micrograms is equal to 1 milligram because the bottle is 50 milligrams. So we're going to convert the microgram dose from milligrams to micrograms. And we have 50 milligrams per 250 ml. So take a look. When I set up the ratio, we're doing opposites on the units. And then we're going to also multiply 60 minutes per 1 hour because remember, the answer has to be ml per hour. So this is how I set it up. We multiply 5 times 1 times 250 times 60. We get 75,000 over 1,000 times 50. The answer is 50,000. 75,000 divided by 50,000 is equal to 1.5. And take a look, we're going to cross out the units that cancel out, micrograms with micrograms. And we're going to cancel out minutes with minutes. And we're going to cancel out milligrams with milligrams. And we're left with ml per hour. And that's what we want the answer to be, ml per hour. 1.5 ml per hour is what we're going to run this infusion at. And next, we're going to do ratio proportion. So let's start the next example. So there are a couple ways to set up the ratio. I'll show you a couple ways to do it. And at the end, I'm going to show you a trick. So to set up the ratio, take a look. The bottle will say 200 mics per ml. In real life, the label will give you the units that the dose is in. So we have 200 mics per ml. So we need 5 mics per minute. So we know that we want to do it 60 minutes because we want to run it ml per hour. So if in 1 minute we're giving 5 mics, how many in 60 minutes? So we're going to do 5 times 60 divided by 1 is 300 micrograms. So the dose is going to be 300 micrograms per hour is what we're going to run this infusion at. And now we have to see how much ml is 300 micrograms. So look at the label, 200 mics per 1 ml equals, and then we're going to set up the ratio, 300 mics per x ml. So x is equal to 300 times 1 divided by 200 is equal to 1.5. So it's 1.5 ml. 300 micrograms is 1.5 ml. And again, it's per hour. Don't forget that it's per hour. And that's the answer. That's one way to do this ratio. Then there's another way to do it, which I'm going to teach you this trick. Whenever you have an IV or a bottle or any medication in 250 ml, and they give you the labels in milligrams, all you have to do is multiply the milligrams times 4, and that gives you micrograms per ml. So again, it has to be this trick only works with 250 ml. So 50 times 4 is 200. So the milligrams, to switch to micrograms, if it's a 250 ml, you do 50 times 4, gives you 200 mics per ml. And again, take a look at the label. Or you can just write 50 milligrams. And we know milligrams to micrograms, we move the decimal point 3 spaces to the right. So what you're going to do is just going to add 3 zeros. So it's going to be 50,000 micrograms per 250 ml. So this is just another way to convert the milligrams to micrograms. So we have 50,000 micrograms, and we want, what's the dose? 300 micrograms. So if you have 50,000 micrograms in 250 ml, and we want a dose of 300 micrograms, which we know we figured out before is what we're going to use per hour. So 300 times 250 divided by 50,000 is equal to 1.5 ml. And again, don't forget it's per hour. So these are a few different ways you can do this problem. If you need help, just put the question in the comment. And I just want, again, just take a look at this bottle. This is a real bottle. This is what we use in the hospital. Get used to seeing these concentrations. Get used to seeing what the label looks like. And that's it. It's just practice. Just keep doing these problems. Okay.